Hi, I'm Dr. Bill Lile and I practice obstetrics and gynecology. I'm licensed to practice medicine in both Florida and Alabama, and I am board certified in obstetrics and gynecology. Recently, I've been getting lots of questions. Dr. Lile, can you really reverse an abortion? Well, a surgical abortion, no, you can't reverse a surgical abortion. There are some cases where an abortion has been attempted on a baby, but they failed and they were unsuccessful in performing the abortion, and the baby has actually survived the attempted abortion. But you can't reverse a surgical abortion once it's already been performed. Now, what about the fastest growing form of abortion? The fastest growing form of abortion is actually a medical or a chemical abortion. And that is growing. It's the fastest growing form of abortion, and depending on the state, it can be 25, it can be even up to 50% of the reported abortions are being done with a medication called RU486. What is RU486? It is a hormone blocker. RU486 is very effective at blocking a hormone called progesterone. Well, what's progesterone? Progestation. This is the hormone that is released by the corpus luteum, a cyst on the ovary, when a woman becomes pregnant. The test that we do with a pregnancy test looks for a hormone called human chorionic gonadotropin. That's a hormone that's released when the baby first starts to develop. When the egg and the sperm have gotten together and they implant on the lining of the uterus, human chorionic gonadotropin is released. Well, this is a signal that goes up to the ovary and it says, hey, congratulations, we're pregnant. Keep that hormone progesterone going. And there's a cyst, which is normal. There's a cyst on the ovary called the corpus luteum, which continues to release progesterone until the placenta is big enough and it can really release a lot of that hormone, progesterone. RU486 blocks that hormone, progesterone, progestation. So the body's like, hey, congratulations, we're pregnant. Let's send all the support down to the lining of the uterus. Let's not have a cycle, but let's support this growing pregnancy. Then RU486 is given, and the body's sitting there going, I thought we were pregnant, but I don't see any more progesterone, so we must not be pregnant. If we're not pregnant, then there's no reason to support a pregnancy. So can we reverse that effect? What if we were to give more progesterone? Well, we've done that. In fact, there's been hundreds of times where an abortion has been attempted with this medication RU486, and then hormone progesterone is given to override that. Well, how do you remember that name RU486? Well, I remember it. I was a server all through college. I worked my way through college as a server. It's an honorable way to make a living, and you work hard and you make good money. If the chef put a message up on the dry erase board and the chef said, hey, 86 the meatloaf special, what does that mean? It means kill the meatloaf. We are out of meatloaf, no more meatloaf, 86 the meatloaf. So listen to the name of that drug, RU486. It's a question. Are you for killing this pregnancy, 86ing this pregnancy? So can we reverse it? Yeah, we sure can. And it's not some sort of a voodoo wild thing. We use a hormone called prometrium that is micronized progesterone. Well, it's not something that, wow, I wonder if this would work. We use prometrium all the time. Not only do we use it when it comes to regulating a woman's cycle who hasn't had a cycle in a while, but we use it to support a pregnancy, to give progesterone, to say, hey, you're pregnant. When do we use that? There's something called a luteal phase defect, where a woman maybe has a history of recurrent miscarriages, and we check progesterone levels and they're low. Well, what's the normal thing? If a level is low, well, we supplement it, and we actually give this hormone, prometrium, micronized progesterone, to patients so that they can maintain a pregnancy that might otherwise be lost. But also when we do in vitro fertilization, which is amazing technology, when we give in vitro fertilization and we implant a pregnancy into the lining of the uterus, the body wasn't really expecting this. It was kind of a surprise. So it doesn't have its natural progesterone. So what do? We supplement with progesterone, with prometrium, to say, hey, you might not have known this was coming, but you're pregnant, so we're going to keep this pregnancy going. Also, Progesterone is used to prevent preterm labor. It relaxes the uterus. We use it for patients who've had preterm labor. Sometimes we'll use it all the way up until 36 weeks pregnancy just to keep the pregnancy going. So prometrium is not some sort of a wild medication that we're using to reverse an attempted abortion with RU46. It's something that we use in obstetrics and gynecology all the time. It's a routine medication. So when somebody has been given this medicine, RU46, and then they have second thoughts and they said, I really didn't want to do that. What was I thinking? Just like if somebody overdosed on narcotics, that wasn't their goal. The goal was not to overdose on narcotics, but they took too much narcotics. It was a bad decision. So if they show up in our ER, what does our ER do? Our ER will give them Narcan. Narcan is a very effective reversal agent when somebody's been given too much narcotic. Well, when somebody's been given RU46 and then they decide this was not a good decision, well, just like we give Narcan to reverse a bad decision, we can give prometrium to reverse a bad decision. And we've been very successful around the country with reversal protocols where we can give them progesterone to keep that pregnancy going. How long after RU46 is given can we still be successful? Well, sooner is better than later. Day, 2 days, maybe 3 days. It's real important to try to initiate that early. And there's lots of protocols that we use, and we use the same medicine, the same doses to reverse the effects of RU46, and we have been successful with that. So when you hear about abortion reversal, yeah, it's reversing the effects of RU46. And well, does this cause problems with the babies? We don't see any evidence of this causing any kind of problems. You're either going to be successful or you're not going to be successful with this. It's not somewhere in the middle. We don't see any evidence of prometrium causing birth defects. We've been using it for lots of years in people who've had in vitro fertilization, people who have recurrent miscarriage, patients who've had preterm labor or histories of preterm labor. We use it all the time. It's not some sort of a new voodoo. It is common standard practice. So if somebody has a low progesterone level, we supplement it with progesterone. If somebody has been given a medication to give them a low progesterone level, we can reverse that medication by giving them progesterone. So it's amazing science, and it's amazing that we can offer this kind of therapy for somebody who says, I made a bad decision, and is there anything I can do to reverse it? So hopefully that clears things up as far as abortion reversal protocols. It's an amazing science, amazing technology. You're going to see a lot more about that in the future, and its availability is going to be much more widespread. If you have any questions, please don't hesitate to contact me. You can contact me through my website, prolifedoc.org. God bless y'all, and y'all have a great day.